Hi, I'm Tampa Oral Surgeon Dr. Ted Grellner. What I have for you today is a story by number video, multiple short stories about what a few people went through with their wisdom teeth at different ages, thus the numbers. Now, I know what you might be thinking right now. I don't need to listen to stories. I just need some quick information. Just tell me when. Well, you clicked on this video because you were interested in finding out when to remove your or your child's wisdom teeth, but to truly understand what I'm about to tell you, you need to watch this entire video to the end. I guarantee you will look at wisdom teeth differently in just a few minutes. As a college student, I was probably in many of your shoes. I made every mistake you can regarding wisdom teeth. Today, having the knowledge and experience of a career in oral surgery, I would have made a very different choice, and as a result, had a much more pleasant experience with my wisdom teeth. Now let's talk numbers. 100. The oldest patient I have ever removed a wisdom tooth, much less put to sleep for a surgery. She had developed a cyst around an impacted wisdom tooth she never knew she had because she had been wearing dentures for years. She had a problem because a fluid-filled cyst growing around that wisdom tooth had grown to the point where she could no longer get her denture in. 75, a nursing home patient who was in ill health, falls, breaks his lower jaw where it was weakened by the presence of an impacted wisdom tooth he had never had removed earlier in life. Though 25 years younger than the previous patient, he barely got cleared by his medical doctor to go to sleep to have that wisdom tooth removed and the broken jaw plated back together in the operating room. Now, typically, you'd think of wisdom tooth problems as being limited to the young. Well, this is hardly a fun experience to have in your golden years. 60. A man with an infected, impacted lower tooth that he had ignored for far too many years. This tooth was now sitting in bone so hard that not only did a root fracture while we struggled to remove the tooth, but it was fused to and visually indistinguishable from the bone surrounding it. It required a second surgery to remove the root later with much difficulty because it ended up giving him trouble. 50. A businessman, again too busy to deal with chronic intermittent pain in his lower jaw where he had a deeply impacted wisdom tooth. After antibiotics to finally calm the infection, it was very difficult to remove this wisdom tooth, which was laying completely on its side with the jaw nerve lying directly underneath the tooth along the entire length. Thankfully, I was able to remove his tooth with no residual numbness afterwards. However, his chronic pain never went away. During a second surgery, I found that he actually had chronic infection of the bone called osteomyelitis, which required removal of the dead bone, again without injuring the jaw nerve that was lying within it, followed by months of penicillin to eliminate the persistent infection. 25. An airman with an infected gum around his partially exposed wisdom tooth. He had had problems with this area intermittently for several years. However, this time he was in so much pain that he begged that it be removed immediately. I made the mistake of doing this for him, placing him immediately on antibiotics for his infection. However, he came back several days later with a large infection of his face, his neck, his throat that was close to affecting his airway due to the size of the swelling. He required immediate surgery to drain the pus, stabilize his airway, and strong IV antibiotics given in the ICU of the hospital. Particularly nasty bacteria causing his infection, combined with the opening of the gum tissue to remove the tooth, releasing the boundaries of the infection, is what allowed the infection to spread more quickly. Combining the natural delay of the oral antibiotics to treat the infection with the difficulty of treating what turned out to be particularly nasty bacteria that would have never reacted to the penicillin that I put him on. He was released from the hospital about a week later after a very difficult experience. No one wants to painfully wait for antibiotics to treat an infection before having the offending tooth out, but it is truly the safest way to do it. 20. A very attractive college co-ed whose lower wisdom tooth roots had finished growing, usually the case at 20. Her problem was that she not only had 4 separate roots, rather than the usual 2 or 3, but because of limited room for those roots to grow, they had grown past her jaw nerve on both sides like a cowboy's leg straddling a horse. Her surgery took nearly an hour and a half to carefully remove her wisdom tooth to reduce the chance of nerve injury. The result was a week of temporary numbness, only a week. Her response was, why wasn't she told of the risk of this possible numbness so she could have had her wisdom teeth out earlier? Well, indeed, why not? 19. A college student who waited until his wisdom tooth gave him trouble, which you know now to mean infected. After a week's course of antibiotics to eliminate the painful infection, he chose to have the one tooth removed awake, using local anesthesia only. Now, while 19 sounds young when it comes to wisdom teeth, each of the 4 long, narrow, curved roots broke during its removal from his very hard jawbone. It was such a difficult procedure to remove the remaining roots that he remembers the experience vividly to this day, almost 50 years later. If you don't want to remember a procedure, you don't want to be awake for it. Finally, 17. A girl referred by a dentist who recognized that her 4 impacted wisdom teeth were not going to come in properly. Fortunately, they had not started to come through the gum yet, so she was having no trouble with them. Since the roots were not finished growing, the surgery at this age was much easier than it would have been just a few years later. It took only about 45 minutes to remove them, 15 to 30 minutes faster than it would have taken, years later. A recovery period shorter by 1 to 2 days than she might have expected later, and a shorter period of surgical pain. Back to school on Monday from a surgery Friday morning. Absolutely easier and less complicated than at any time later in life. When you have your wisdom teeth removed matters. When should you remove your wisdom teeth? Well, definitely before they start to give you trouble, where they're infected or are damaging the neighboring teeth. And as young as you can, before medical issues or aging increases the difficulty and risk. Women, don't forget pregnancy as one of those complicating medical issues. Ideally, mid-teens, somewhere between 15 and 19, and we can help you to find when. Before the roots finish growing, and before the soft, immature bone of a teenager's jaw hardens at 20. If you'd like a better experience than what the grapevine tells you should expect, call us at 813-972-3478. We can help because I have spent a career looking for ways to make the entire wisdom tooth experience much more comfortable. From start to finish with less risk. Remember, you have only one chance to do this right. For more information, contact our office at 813-972-3478 or go to the websites tampawisdomteeth.com or our main website, grellnerdds.com.